Hello, everyone, and thanks for attending the Pinnacle Quality Insight CAHPS Q&A session, Lunch with Angell. Today, we're pleased to have Angell Hansen, Account Manager at Pinnacle Quality Insight, who will be answering questions. My name is Kimberly Sondrager. I'm the Marketing Manager. Before we begin, let's start with some housekeeping items. First, I would like to direct you to the control panel on your screen if you're joining us online. At the top of the control panel, you will notice an orange arrow that points left. When you click on this button, the control panel will open. Here you will see audio options and a question section. You can hear our webinar today either through your computer's audio or on your phone. A dial-in telephone number is listed here. This is a broadcast-only webinar, so the audience is muted. However, we invite you to share comments and questions by messaging us through the control panel. Below the audio options section is the questions section. If you have questions for Angell that you have not sent her prior to the Q&A session, please type your questions here and press send. When you exit the Q&A session, you will have a short survey that pops up on your screen, and we invite you to take a moment to participate in the survey so we can continue improving. After the webinar is done, we will email you a recording of the Q&A session, and if you would like to receive the handouts as an email, please reach out to Angell after the webinar is done. And her email is angell.hansen@pinnacleqi.com, and Hansen is spelled with an O. All right, with the housekeeping items out of the way, I'm pleased to turn the time over to Angell.
Hello, and welcome to our second edition of Lunch with Angell. I appreciate all the feedback, positive and negative, from the first session. My main goal for these sessions is to give you an opportunity to reach out with your questions, give us feedback on the CAHPS surveys, tell us what's working for you and what's not, and to help you make the best of the CAHPS process. We understand that the CAHPS survey is only one small cog in your agency's quality improvement machine. If this piece can work well and to your benefit, then your machine, which is your business, can run well too. Just to clarify, if you're on this call, you are a current Pinnacle client who has the product Home Health CAHPS surveys, Hospice CAHPS surveys, or both. The discussion will be focused on these surveys. Hopefully you're seeing the poll question that has come up. Please take a moment to answer the poll. Thank you for that. Now for some business items. The question for today is, what is a recent article or resource that you've come across that has helped you with quality improvement? I'd like you to share this information with me so that we can benefit together as a Pinnacle community. We can share this information on our blog, and I can send it out as email information. I feel like a community being together will be helpful to keep us all on the same page. So this slide you're looking at now, many questions I answer can be found on the official CAHPS websites. If you haven't looked at them in a month, do so now. It's good to check this website at least twice a month for any new announcements concerning the CAHPS surveys to stay up to date. For home health, go to homehealthcahps.org, and for hospice, go to hospicecahpssurvey.org. Now, fair warning, I'm getting on a soapbox. What I'm about to say is great training for new employees and a great refresher for seasoned employees. Remember to preview your export before uploading it to us. Software vendors may make updates to their system, and it's up to you to ensure that the data is correct and everything that CMS has asked to be reported is included in your export. Most of the file formats can be opened easily in Excel, and a quick glance will find these errors that are very common. The first error is the incorrect month. Another error I see is a blank file. I've also seen invalid formats. It's not even a CAHPS file. And sometimes we'll see missing patient names and missing patient phone numbers. All right, our poll results are in. 40% said awesome. 60% said meh, so-so. That was just a fun way for us to get things started today. Now, since Pinnacle uses the telephone mode, the phone number is very key. Several of you have worked hard to make sure that the phone number doesn't go to a facility where we cannot reach the patient or a caregiver. For home health, you can only send us one phone number. So make sure it is the best one for us to contact the patient or proxy for them to conduct the survey. Patient eligibility for HHCAHPS to be included in the sample, they must have a payer source of Medicare or Medicaid. An eligibility error that has come to light this month. So this doesn't apply to hospice. Since you send us all your decedents, those patients who have expired, no matter the payer type. For home health, make sure that all Medicare and Medicaid payers are included in the export and that private pay or private insurance are not. And also make sure that it does include Medicare, Medicaid, HMOs. That was a little issue that I worked with an agency this month. They were able to work with their software vendor and got everything straightened out. If you find that more than half your patients do not qualify for the CAHPS survey, then you need to get Pinnacle's home health satisfaction surveys. Is it only the Medicare, Medicaid patients that you are interviewing? Then you're missing half or more of your patient results, patient satisfaction results. So make sure that you tap into that other area. Now for hospice, if you have a large number of live discharges or revocations, there's also valuable feedback you are missing because the CAHPS survey does not talk to these or interview these type of clients. So let me know if you'd like to learn more, and I can direct you to our business development team. We can offer a pilot program so you can test the other style of satisfaction surveys. Next, the patient must be at least 18 years of age. Sorry about that, I went to hospice too soon. And presumed alive. The patient, and this is back to home health, must be a current or discharged patient who has had at least one skilled home health visit in the sample month. The patient must have received at least 2 skilled visits in the look-back period, and this is talking about the sample month and the month prior. And the patient has not been included in the sample in the 5 months prior to the current sample month. There are other ins and outs to eligibility, but those are the main ones that you need to focus on. Most of your software vendors have this all figured in to the CAHPS export, but it's good to know these so that you can double check from time to time that your software is functioning correctly. So now let's move over to hospice eligibility requirements. Every field is important, but these in particular will have an effect on your response rate and scores if they are missing or incorrect. The export must include the decedent's birth date and death date, the payer for hospice care, a primary diagnosis and secondary if your software allows, the caregiver's relationship to the decedent, and this is a specific number code, not text. We also need the primary language, especially if it's not English. If it's not included or something that is not surveyed, English or Spanish, the system will default to English. If the primary language is Spanish and it is not marked, then the phone number will go to an English interviewer first. So marking the correct language is important. Next, we need the first and last name of the caregiver, both of those together. Here's some rules for this. If there is no caregiver, go ahead and leave it blank and mark the caregiver relationship as 8, which is no caregiver of record. That's a newer field that has come out, so double check that your software has switched over to this. If there is a husband and or wife that can be contacted, you may put 2 first names in the first name cell and 1 last name in the last name cell. And lastly, phone numbers of the caregiver. Again, we use the telephone mode, so if there's no phone number, no interview. For hospice, you may send more than 1 phone number. If there's a home, cell, and work number, include all 3. It will increase your chances of us getting in contact with the caregiver and conducting the survey. Now for home health and hospice, if any of these data elements are not provided, then final CMS scores may not be adjusted correctly. This is what is called case mixed adjuster variables for hospice and patient mixed adjustment for home health. Here's how that process works. So we'll conduct the interview and send you raw monthly scores for the CAHPS measures. Then quarterly, those scores are sent to CMS. CMS then mixed adjusts those scores for mode and other attributes to even out the playing field for the wide variety in the population. And finally, those scores are posted to Home Health Compare and Hospice Compare. If you come across any questions or errors looking at your report, you may need to contact your software vendor or EMR provider for answers and help, but I'm also available to help you review your export. We can do that one-on-one to ensure that all the data elements CMS is requiring, they are receiving. Now, let me get off the soapbox. Let's move on. I'd like to build on the foundation that we started last month. Here you can find a link to the YouTube video that will connect you to last month's webinar so you can get a review. You can also now remember, these are the attributes that Pinnacle Quality Insight found in top performers. So last time we learned about 7 points for improving patient satisfaction, which are treat everyone with importance, explain to the 4th, exceed expectations, lose weight, make lemonade from lemons, bragging right, and investing in employees. And today I want to touch on again, investing in employees. This foundational principle is so important. When your employees feel cared for, then they pass that feeling onto your patients, and your patients are happy, and we all have happy patients. And I'm also making a shameless plug for our new product, Retain. If employee retention is an area you're struggling with, like a large percentage of the healthcare industry, please contact our business development team for more details. Retain is an online tool that surveys your employees to track their engagement. During the pilot phase of this program within our own company, we were able to greatly reduce the turnover of our own home interviewers because of the Retain system. It allowed us to pinpoint key areas of concern and address them and correct them. You may have current strategies to reduce turnover, but Retain system will help you take it to the next level. Okay, back to our recap. We breezed through some other topics like staying compliant, CAHPS measures, home health compare and hospice compare, star ratings, pinnacle reports, and how to make a QAPI or HQRP goal. This was the outline that we recommended to adopt your focus for at least a 3-month time frame. So if you made a goal last month, we're on the first month. How's your goal coming along? Did you write it down where it is visible on a poster with your starting percentage and your end goal? Do you have specific action items for each goal? Have you celebrated success? And what are you doing to recognize employees? So I have 2 images to show you. The one on the left-hand side is a beautiful, perfect spider web. Now don't get squeamish on me, everyone. Take a moment and imagine the time it took for the spider to create each frame thread that anchors this web to the supporting structure. These threads are like the frame you've built in your organization that are part of your culture and your quality improvement plan. Then the radius threads combined with the auxiliary spiral extend out from the center to the outer edge. This took a lot of time to make the spider web, as it did a lot of time to make your quality improvement plan. The spiral represents the day-to-day actions that you take that continue to build and support your entire organization. Let's focus on the image on the right-hand side. It is a spider web that is clearly damaged. Not all the frame threads are secured to a structure, and the inner threads are scattered or broken. The function may still be there, but the support is definitely not there, and it is not clearly outlined. So take a moment and think about your system for quality improvement. Is it easy to understand and follow by every employee? After today's discussion, you may wind up with more questions than answers, so feel free to let me know what your thoughts are. What is working? What is completely flopped? Part of your responsibility as a quality assurance team is to continually learn. So if you're just joining us again, there is a question I'd like you to answer. What is a recent article or resource that you've come across that has helped you with quality improvement? As we share these things, we all learn together. So some examples that I have seen out there is participating in the CMS open door forums, which happen roughly quarterly. And CMS also offers other trainings. Use the AHRQ's website for research. And for home health, there's a great resource called Home Health Care News. And they've just started a forum for hospice called Hospice News. Let's share these resources to help each other grow. One industry trend for home health, we are aware of PDGM. The CAHPS survey does not have any changes proposed due to this. However, I have learned you need to lean more on quality improvement to be successful in PDGM. We are also aware of the new hospice tool being developed called HEART, H-E-A-R-T. It is in the early stages of development, and I've learned that there are no changes or impact on the CAHPS survey due to this either. So let's go back to the spiderweb example. Build a foundation for your quality improvement program. It may start with some of the tools we give you, like the staff checklist, but you need to go beyond the checklist and make quality improvement part of your agency's culture. So let me share with you 2 tools that are helping agencies with the response rate and scores of the CAHPS survey. The first tool is called the Pinnacle Survey Memo. This memo may be distributed to your patients and their caregivers during the admission process or intake in order to prepare them for the survey and help them understand the importance of participating. I want to turn your attention to the GoToWebinar platform in the handout section. The document for English is available for downloading there, and you may also contact me to forward those documents to you. We've also included the phone number that will come up on the caller ID, assuming the caller ID works correctly, when we are calling. This should help your patients feel safer to answer the phone since they will be able to identify when we are calling. For home health, it is 1-877-308-3844. For hospice, it is 1-888-444-9961. I just recently talked with an agency that is putting these phone numbers on a brochure to, as one other strategy to help patients feel safe and secure. As we all know, telephone calls with telemarketing and auto dialers is kind of out of control. So this helps combat that issue. The more you emphasize the phone number to patients and caregivers and that you want them to take the survey, the better your response rate will be. I've personally looked at a response rate of an agency before using the memo and 3 months after using the memo, and there was a marked difference in their response rate. So when you get this memo, it's really a template. You may print it on your letterhead and have the administrator sign the letter at the bottom, personalize it a bit. It's available in English, Russian, and Spanish. Russian is for home health only. Keep in mind, you may not send the family memo to the caregiver for hospice after a patient has expired. That is a very clear rule that has been discussed with the Hospice CAHPS team. The other tool I'd like to remind you about, because we talked a little bit about it last time, is the staff training checklist. Pinnacle has done a lot of the legwork for you and developed this. This checklist ties directly back to the survey. Every item on the checklist correlates to a question, which goes into a measure in the CAHPS survey. To effectively use this checklist, it must be used every time your agency interacts with the patient and their family. Print them out and laminate them as a reference or include them with your patient charts. You can also integrate these into your current patient checklists to ensure that all of the CAHPS information is being integrated in what you're already doing. We don't want to add more work for you. This is a tool that is designed to help you. You can also make it a digital version for tracking. So using this checklist provides accountability so that you know that when your caregivers visit patients, they're addressing everything that is going to be asked on the CAHPS survey. You can change, again, the specific checklist item to be more specific as a quality improvement goal that your agency has established. For example, in the ultimate goal section down at the bottom, it says to provide the best home health care possible to every patient. Now, your agency has probably talked about how to do this, and so use that checklist item as specifically what your agency and your culture is going to do for the patients. Now, if you make any changes, make sure to keep the original intent of the checklist item so that patients can remember when we're talking with them about the CAHPS questions that you addressed medication or pain, because those are specific items, for example, that we will talk about in the survey. These checklists also help you remember to tell every patient and caregiver about the survey, that it's a government survey that will be conducted over the telephone, and that it means a lot to you that they complete it. It opens the door for you to find out if there are any issues they are having with the care, and for you to take the time to address those before we contact them for the survey. And that allows you to react in a proactive manner instead of finding on the survey comments like they weren't on time, the nurse was rude, other things like that. You can find out. To wrap things up today, the last time I spoke about the owner of the company, Stan Magleby. Today I'd like to introduce you to his son, Chris Magleby. Chris has earned his way to be the CEO of Pinnacle. His personality, he's a quiet, thoughtful leader, but he is a driving force in this industry and has a deep concern for helping people. In a recent training, he told us, we can be great right here where we are by how we serve others. Here at Pinnacle, we have the unique opportunity to help others do this. Understand the impact our clients have on seniors. Part of our responsibility is to provide feedback to clients so they can be the best they can be. I take his words to heart and hope you do too. As you are out there and you're serving your community and patients and their families, understand how unique you are and all the abilities you can contribute to the healthcare industry. Thank you again for participating in today's webinar. I'll turn the time back to Kim for questions.
Thank you, Angel. Okay, if you have questions, this is a great time to ask them. To do so, open your control panel by clicking on the orange arrow that is pointing left. There is a question section where you can type your question and press send. Okay, it looks like we have our first question in here, Angel. It is for home health CAHPS surveys. Can we send you a different name along with the patient?
Okay, so for home health CAHPS, we're only allowed to submit the patient's name. But when we do call the patient and ask for them, it gives an opportunity, if you gave us a different phone number for the caregiver or the proxy, whoever it is, to say that person cannot talk on the phone, they're physically or mentally incapable. I know about their care and I can do the survey. So that will help you overcome that situation where you can only submit the patient's name in the home health CAHPS export.
Okay, last call for questions. Okay, if you, I'm not seeing any more questions in here, but if you do think of any additional questions that you would like to ask Angell, you're welcome to contact her directly at angell.hansen@pinnacleqi.com. And thank you so much for attending Pinnacle's CAHPS QA session Lunch with Angell. As I mentioned earlier, we will email you the recorded webinar, so keep an eye out for that email in your inbox. We will also post the recorded webinar on our YouTube channel. Thank you, Angell, for this Q&A session. We look forward to another Q&A session on the first Wednesday of next month. Until then, have a great rest of your month.